Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. We're also happy to be joined this afternoon by the Deputy Mayor of London, Josh Morgan, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie, and the Chief Medical Director at London Health Sciences Centre, Dr. Adam Dukelow. Normally today we would be joined by the Warden of Middlesex County, Cathy Burghardt-Jesson, but like many people today, who are affected by the service interruption with Rogers. We are going to see if she can join us later, but she is not able to join us right off the top this afternoon. Welcome to the media who are in attendance as well, and we thank you for your questions and look forward to those. If you have not yet submitted a question, you can use the question forum here on Microsoft Teams. Just click on the text bubble with the question mark, indicate your name, your media outlet, and who your question is for. And finally, a welcome to those tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are watching on the CTV London website. Let's get to our opening remarks, and we'll start today with London Deputy Mayor Josh Morgan.
Well, thank you, Dan. Good afternoon, everyone. Obviously, with the new COVID regulations announced by the province late Friday afternoon, followed by several amendments the next day, it was a potentially confusing weekend for many. In case there's any lingering confusion, I want to reiterate, playgrounds in London are open for kids and families to use. As well, no Londoner will be arbitrarily stopped or detained while out for a walk or a drive by a member of the London Police Service or a bylaw officer. The police chief, the London Police Association, have made clear over the weekend they would not exercise the new powers as part of COVID enforcement, while the mayor has been equally clear that the same is true where bylaw enforcement is concerned. This is consistent with the approach we have always taken, and this will remain our approach moving forward. That does not mean all bets are off where COVID restrictions are concerned. In fact, I can share with you today that 2 charges have now been laid as a result of a large rally that took place back on March 20th in Victoria Park. A 38-year-old woman and a 24-year-old woman have each been issued a fine for organizing an outdoor gathering which exceeded the number permitted. If convicted, those fines can run as high as $10,000 each. As well, a 21-year-old woman was charged over the weekend while participating in a large gathering in a home on Beaufort Street near Western and Warncliffe. As we've said before, the ultimate goal is that people are not putting themselves into positions where fines become necessary. When that's the case, the risk of COVID transmission has already occurred. However, we have a duty and an obligation to enforce public safety measures, especially in cases which are so far beyond the point of education through issues or warnings. That's the update I have for now. I look forward to the questions, Dan. You're muted, Dan.
Thank you very much, Mr. Deputy Mayor. Let's go to Dr. Mackie.
Thank you, Dan, and to the Deputy Mayor. Well, we may be starting to turn the corner here in London and Middlesex. Just 69 cases to report today. That's less than half where we were about a week ago. The case count from yesterday was also much lower, just under 100 cases reported yesterday. We did have another death report today, another person in their 60s. That means 4 of the last 7 deaths in our community have been people in their 60s. It's another reminder of how important it is for everyone in the age group over age 60 to get vaccinated. We've had excellent uptake in people above age 80, around 80% and climbing. The last update we had on people aged 75 to 79 was that we had vaccinated 73%. That's from about a week and a half ago. We expect new numbers from that group from Public Health Ontario either today or tomorrow. But we unfortunately still are seeing deaths in the population age 60 to 69, where the vaccine campaign has only recently begun to give shots, and some people haven't been able to sign up yet. At this point, we are booked at all of the London clinics, London and Middlesex clinics, for just over a week into the future, but we do have available bookings for people in the over age 60 group beyond a week from now at most of our clinics. So very much encouraging people who are over age 60 to go get on that covidvaccinelm.ca website and book your vaccine as soon as possible. There's some appointments that are actually quite soon. Please do get on there and book those appointments. Again, almost all of the deaths that we've seen in this community straight up for weeks. And over the last few days, you've seen that spike start to reduce. Still seeing cases over 4,000 a day at the provincial level, but that's not a major jump as we had been seeing previously. So that's encouraging, all of that pointing to the fact that the lockdown, shutdown, stay-at-home measures are making a big difference and that people are following them. So that is very much appreciated. It's a huge, huge sign of progress on behalf of all of our community and across the province. We need more. We are not done. There's still weeks to go, but we're moving in the right direction. Then I'm going to pause there and looking forward to hearing from Dr. Dukelow.
Thank you very much, Dan and Deputy Mayor Morgan. And thank you, Dr. Mackie, for your comments, especially the optimistic ones around the case numbers starting to fall. I do appreciate the opportunity to join today's briefing and provide an update on the situation at London Health Sciences Centre. As many of you will recall, case numbers in the community start to fall. We don't see our case numbers in hospitals start to fall for a couple of weeks after that, at least, as people are diagnosed and then they don't end up in hospital till a few days or a week or two later. This morning, we reported 78 COVID-19 inpatients, 36 of which are in critical care. These are the numbers from 3 o'clock yesterday. As of noon today, we have 86 COVID-19 patients in hospital in medical beds or level 1 beds, 86 total and 39 in critical care. Of those 86 total patients, 53 are from London Middlesex or within our normal region, and 33 have been transferred in from outside of region. This is the highest amount of COVID-19 positive patients we have ever cared for, and I want to thank each and every staff member and physician at LHSC for their contribution to care for these patients. Our teams are tired, but they continue to dig deep and provide the best possible care for their patients. In the past week, we have made much progress in our planning and our readiness. We continue to anticipate more patients both locally as well as from other centers in the province. We have opened additional beds at both Victoria Hospital and University Hospital, provided education to our providers on the emergency standards of care in the event they need to be activated by the province. We have redeployed our own staff within LHSC, and we are beginning to receive staff from other hospitals. I want to provide a thank you to our colleagues at Middlesex Health Alliance, as well as St. Joseph's Healthcare, for providing staff to help open new beds in the London Health Sciences Centre ICUs. Our planning from the past year follow the stay-at-home order, as well as other public health guidance, we should begin to see the benefits not only in our community, but in our hospitals of our collective efforts over the coming days and weeks. As Dr. Mackie mentioned, if it's your turn to be vaccinated, please book an appointment and get that needle in your arm. Lastly, I want to remind everyone again that our hospitals are safe and our emergency departments are open. If you need emergency care, please do not delay coming to the hospital. Thank you to all those who attended today, and I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Mackie, and Deputy Mayor Morgan. Let's get to those questions right away. Jennifer Beeman is first in line today. Dr. Mackie, her first couple of questions are for you. So let's get into that. Jen Beeman from the London Free Press. Dr. Mackie, how much is our vaccine allocation being reduced by? Will the health unit be forced to close a vaccination site or cancel appointments?
Yeah, so it looks like our vaccine allocation for Pfizer will be going down by about 3,500 vaccines for next week as compared to last week. We're getting a bump the current week, and that's in recognition of the work that the health unit has done to vaccinate urban Indigenous populations. We've been reporting that work up to the province, and the province has recognized the work and is sort of reimbursing with additional vaccine allocation for this week. But next week, we do see that drop about 3,500, which is about 25% of our weekly allocation of Pfizer. The AstraZeneca numbers will climb primarily through the pharmacies. We have very small doses coming in for primary care, but things are ramping up with AstraZeneca in the pharmacies. Moderna doses are pretty flat and are at this point a minimal contribution to our campaign here. We do get a bit of Moderna, and it helps with things like vaccinating in hospitals where the hospital can hold that vaccine in their refrigeration system for some time, which you can't do with Pfizer. But Moderna is unpredictable. The deliveries are almost always delayed, and it's making it, and I mean the allocation of Moderna here is small as well, so it's not as big a factor. I want to be clear that we understand the need to devote vaccination doses to the communities that are being hardest hit. We absolutely get that there are communities with rates of COVID that are much higher than what you're seeing here. Our community has been catching up, but we're really pulling away in a positive direction at this point in terms of case counts. And so in that sense, you know, we are all part of Team Ontario, and we completely understand the decision as it's being made. At the same time, it is somewhat frustrating. You know, we do have much more capacity in this community to vaccinate than the vaccines that are coming here. I don't see this impacting a closure of a site at this point. If we saw further reductions, it might. But at this point, we plan to keep our 3 mass immunization clinics up and running. And we do have a bit of vaccine for mobile as well for those smaller congregate settings that are otherwise high risk.
Thank you very much, Dr. Mackie. Let's go to a follow-up question from Jennifer Beeman. Dr. Mackie, will the reductions delay the health unit's planned expansion of eligibility at the mass vaccination sites over the coming weeks?
At this point, the reductions, I mean, we're seeing them far enough in advance that we can plan for them. So they're right in our planning expectations. So, you know, we do expect to open up some additional eligibility this week, probably an announcement for that on Wednesday or Thursday in partnership with neighboring health units. But the reductions in future weeks won't affect that. So I guess that's, I mean, it is really helpful that we do get those allocations weeks in advance so we can plan for them.
And Dr. Mackie, I know you mentioned that we're all part of Team Ontario and we all have a role to play, particularly when it comes to ensuring the vaccine is in the most affected areas. But Jennifer has a question that is related to that. And she asks, Dr. Mackie, what would you say to Londoners who are upset that doses are being diverted to hotspot zones, which is affecting our local rollout?
You know, I think that everyone involved in the vaccine campaign, from the federal, provincial, local governments right down to the health unit, wishes that there was more vaccine available and that these difficult rationing decisions didn't have to be made. This is not something we're used to in any way in Canada. The concept of rationing, you know, this isn't something that our country has really had to experience in any major way since maybe the Second World War. That is the reality here. We have way more demand than needed. It's understandable that vaccine is being allocated elsewhere. The other thing that hopefully is some consolation is that what happens in our neighboring jurisdictions affects us. And we know when things are burning like they are in Toronto, there's spillover to our community. You're seeing that in a big way with healthcare right now. As Dr. Dukelow mentioned, patients being shipped to the London area from GTA hospitals. And so if vaccine can go somewhere where it's going to prevent cases, reduce spread there, and reduce the spillover effects here, that's something that helps us all.
Thank you, Dr. Mackie. A final question from Jen Beeman. People 0 to 19 and 20 to 29 are still the age groups seeing the biggest increases on any given day's case count. With many post-secondary students now home, why are these age groups still looming large in the daily case count?
Yeah, so essentially we're still, I mean, there are enough students being tested that it has an effect on our case counts. Just making sure I understand the question. Yeah, so it will take some days for those case counts to decline related to people moving to other communities. We're certainly seeing less there than we were a week or two ago. And part of that is people moving out of the community. And we believe part of it may be some changes in behavior related to the outbreaks that are happening there and the recognition of the importance of people in that age group to stay home. That said, you know, we're probably diagnosing cases from activity that happened days or weeks ago. And so we will see those numbers continue on for some time.
Thank you very much, Dr. Mackie. And I do want to take a moment to let everyone know that the Warden of Middlesex County, Cathy Burghardt-Jesson, has been able to join us. We got the technical issues worked out. So any questions that the media may have this afternoon for the Warden, please do submit those, and we will hear from her with some answers and responses. Let's carry on with the questions in the queue. Another one here from London Free Press, Dr. Mackie. This one is from Jane Sims. Now that the province has opened up the age band for Oxford AstraZeneca to 40 and older, there might be some people 55 and older who may hesitate and believe that they can get a Pfizer shot soon. Can you give them any advice and comment on the number of doses at local mass vaccination centers? Is there any possibility that the age restrictions will open up soon to those over the age of 16, as they have in the United States?
Well, so my advice to everybody is to seek vaccine wherever and however you can, that all of the vaccines are on the scale from very good to excellent. They're all very safe, and that people should be getting whatever vaccine is available to them. We will not be able to open up to all adults over age, all Middlesex-London residents over age 16 anytime soon. We still have people with high-risk healthcare conditions to go through. That's probably tens of thousands in this region. We still have the people who are, can't work from home as another category in phase 2. There will be tens of thousands as well in this region. So please don't wait for Pfizer to become available to you. If AstraZeneca is available, go grab that and get yourself vaccinated. You'll be a lot safer.
Getting caught with the mute button today. Thank you, Dr. Mackie. Let's move on to the next question. Dr. Dukelow, this one is for you. It comes to us from Steve Young at CTV London and News Talk 1290 CJBK. Dr. Dukelow, tell us how things have been going inside LHSC. How many of the COVID patients are currently on ventilators? Also, the adult transport team that was formed on Friday, where have they had to travel to get patients, and is London nearing capacity?
Thanks very much, Steve. I'll take that as sort of a three-part question. How are things going at LHSC? I mentioned in my opening remarks that our staff and our leaders and our docs are all tired, as is everyone. This has been a pandemic for 13, 14 months now. And we've been planning and preparing as well as acting for the duration of that pandemic. However, there is an element to calm when I do have the opportunities around on our wards and talk to people. They feel a sense of, we got this. We will continue to fight. We'll continue to work together, both within our hospital and with our partners to get through the next coming weeks, which we know are going to be the most challenging of the pandemic for the acute care system in London, Ontario, and across the province. In terms of how many patients are on ventilators, 30 of the patients I mentioned, COVID patients that are in our ICUs, are on ventilators. In terms of the adult transport team that was stood up on Friday and has done a few transports at this point in time. And really the goal of that team is to add capacity to Critical and to Orange and to other transportation services across the province in order to enable the number of moves that are happening. For anybody that's in the flight path of Orange helicopters around the province, they would have seen many transfers more than normal happening over the course of the weekend. And so we're just adding to that system capacity to be able to move patients. And to date, the transport team has gone to Trillium, I believe, as well as made some transfers between London and Windsor. So we are really just trying to work as part of the system to add capacity. Thanks for the question.
Thank you. The next question from Steve Young is for Dr. Mackie. Dr. Mackie, is there a risk the second doses that are needed may force the first doses to stop if our supply isn't doubled?
Yeah, definitely an issue, Steve. And we are starting to see some of the second doses that were required from earlier in the campaign come into play over the next few weeks. They're still relatively low doses because we weren't vaccinating as many people back then, but that will be a factor in the month of May for sure. The upside, though, is that we do expect a lot more Pfizer in particular to come on board May and June. And so if the national procurement goes as expected, then the second doses required will be dwarfed by the new incoming doses. So we'll be able to proceed apace with vaccinating people for first doses.
Thank you very much, Dr. Mackie. Next question is for Deputy Mayor Morgan. It comes to us from Andrew Graham at Global News Radio AM 980 CFPL. Deputy Mayor Morgan, prior to Ontario expanding AstraZeneca's eligibility, a number of pharmacies had been asking the province to do so based on the supply that was available. Did you hear similar calls from local pharmacies? If so, what was their reaction to the expanded eligibility?
Well, I'll say, Andrew, I didn't personally hear the calls. The mayor may have, but I can assume that they're happy with the expanded eligibility given they were asking for it. I think, though, this is a good opportunity to reiterate what Dr. Mackie said about taking advantage of being able to get a vaccine when you have the opportunity to do so. So obviously the expanded eligibility at pharmacies will open up to a larger number of Londoners. And for those who can take advantage of using that platform, they certainly should. And so, but I don't have any specific comments from pharmacies themselves to me directly. But this is obviously a good opportunity for that expanded eligibility to be available in our city.
Let's go to our next question. Dr. Mackie, this one is for you. It comes from Hope Mahood at the Western Gazette. Dr. Mackie, do you have any updated case numbers for the outbreaks in the residences at Western University?
For sure, I can provide that, Dan. I'll just bring up our daily internal memo on that. The cases haven't been moving much in residence, so that's relatively good. We have at this point London Hall, Western residents with 6 cases. That all of the Western outbreaks have been identified as with variants of concern, all with the 501 mutation, and most of them negative for the E484K mutation. There's the King's Commons Huron College Western affiliated residence, which has 7 cases. That hasn't changed recently. Perth Hall has 28 cases, Essex Hall 12 cases, Delaware Hall 19 cases plus a person under investigation who did not get tested, who lives outside of our area. The other Western outbreaks haven't moved much. The Elgin Hall residents, 15 cases. Medway Sydenham, 33 cases. Saugeen Maitland Hall, 54 cases, plus 3 probable cases who haven't been tested. Ontario Hall, 18 cases. Those are all, I believe. Let me know if I missed something. You guys are usually as on top of the numbers as we are at the Gazette.
I was, if I may, Dr. Mackie, there was one change that was included in the dashboard update on the Health Unit website today, and that is that the Kings Commons affiliated residents, that outbreak actually has been declared over now. So that one is resolved. So some good news there. I want to pause for a moment before we get into the remaining questions, and I do want to bring in the Warden of Middlesex County, Cathy Burghardt-Jesson. Madam Warden, I'm wondering if you have some thoughts and some remarks that you'd like to share with the group this afternoon before we dive back into the questions.
Well, great. Thanks for that opportunity, Dan. And I will take a moment to thank your staff for getting me online. We all have gifts, and technology is not one of my gifts. So I appreciated the support they were able to give me. I won't take up too much time because I know that there's still a number of questions in the queue, but you know, like many listeners, I think I was very disheartened by the announcement on Friday, and in speaking to my family and friends and residents, not only in Lucan Biddulph, but across the county, there really is a level of frustration that has really built up. And perhaps last week I found in talking to my colleagues that from an emotional standpoint, it seemed to be the worst week of the 13 or 14 months that we've been in this fight. As Dr. Dukelow just said, you know, we're all tired, whether, you know, you're in the thick of it as a frontline healthcare worker, as a grocery store worker, as an elected official, as a mom who has to now juggle work and homeschooling. We're all tired. And, you know, we all have different levels of concern and priorities. And sometimes your priorities may not line up with mine. But I think the thing that we have to remember is that we are all being affected by this in some way, shape, and form. And we all have frustrations, and our frustrations may be different. But what we can agree on is that the constant judging and scorn and shaming that seems to go on every day on social media isn't doing anyone any good. We really need to take stock of our mental health. And I thought today was a good day to just put that reminder out that, you know, don't let your venting become anger. Don't let that take over. There's lots of community resources to help with your mental health. Make sure that we don't lose sight of what I said in the early days of the pandemic. Physical distancing is not social isolation. Check in with your family, friends, neighbors. Now more than ever, we need to stick together, and we will get through it. Dr. Summers reminded us all last week, I believe, that, you know, we really are in the last leg of this race, and the last leg of races are the most difficult. As of last week, the last leg might have gotten a little longer, but, you know, if we put in the extra effort, we will get through this. So with that, I'll let you take over the questions again.
Thank you so much, Madam Warden, and some wise words there as well, and a good reminder that this is affecting everyone and that we all need to bear that in mind as we continue through this race that we've been on for such a long time. Thank you. Let's get back to the questions. Dr. Mackie, the next one is for you. It comes from Matthew Trevithick at Global News Radio, AM 980 CFPL. How has vaccine uptake been for the 60 to 64 age group in the last week? Has it been higher or lower than what was seen in the first 7 days when previous groups became eligible?
Yeah, no, we've seen excellent uptake of the vaccine appointments in those aged 60 to 64. We were able to open up a fourth week of booking, so there were about 15,000 appointments available when we opened up to the 60 to 64 age group, and those all disappeared within about 48 hours of announcing, and we've seen continued strong bookings for several days after that. So we think we have, you know, booked the large majority of people aged 60 to 64 in these communities.
Thank you, Dr. Mackie. The next question is for Dr. Dukelow, and it comes from Jennifer Beeman at the Free Press. Dr. Dukelow, would LHSC or its partners at St. Joseph's consider sending staff to overwhelmed Toronto hospitals?
Thanks very much, Jen. That's a great and a timely question. certainly has been considered. As you've probably seen, there's been healthcare providers being moved throughout the province within London and otherwise, and there's also been calls out to our partners in Atlantic Canada to send healthcare providers to help staff different areas of the province. So we've certainly considered it. The balance is, if we send providers from London, it decreases the amount of capacity we can open up here in London. So I've mentioned we've already opened 18 additional intensive care beds, and we're looking to open more. If we send staff to Toronto, we're much less likely to be able to open additional ICU capacity. So it is in consideration, but not happening at this point in time.
Thank you very much, Dr. Dukelow. The next question is for Dr. Mackie, comes to us from Wendy Spence at the Dorchester Signpost. Dr. Mackie, the number of cases in Thames Centre has increased significantly over the past week or so. Is there any indication as to the source or sources and how the virus spread in the municipality?
I wish I had good information for you there, Wendy. The reality is, with the volume of cases we've seen over the last week, we have not been able to do detailed investigation of any cases. Most of what we're doing is notifying the cases, making sure that they can have they have the information that they need for their isolation and to contact their close contacts for their isolation. We haven't been able to do much in the way of detailed investigation. And so I don't have an answer for you there, unfortunately, Wendy.
Thank you very much, Dr. Mackie. Matthew Trevithick is next from Global News Radio. Dr. Dukelow, how does the 86 COVID patient figure compare to overall patient numbers at LHSC? What is LHSC's current ICU capacity when factoring in the 39 COVID patients?
Thank you very much, Matthew. Our current inpatient status, if I take into account all medical, surgical, and ICU patients, we have approximately a total of 325 inpatients at University Hospital and 350 at Victoria Hospital. And so the 86 would be a portion of those numbers. And in terms of our ICU capacity, based on having opened those additional 18 beds, our current occupancy for critical care is sitting at about 70% at each site. But we will continue to receive likely between 2 and 5 patients from the GTA for the duration of the week on a daily basis, as well as our own local patients.
Thank you very much. Let's go to the next question. This is another one for you, Dr. Dukelow, so we'll stay with you. It comes from Carrie McKee at CBC London. Dr. Dukelow, where are the patients coming from if they aren't from our catchment area? Are they all from the GTA?
The past week or so, yes, they have all been from the GTA. You might recall a month or so ago, we received patients from Thunder Bay, but over the past week or two, all the patients we received have been from the GTA.
And right now, our last question, pending something else flying in at the last second, but this one also is for you, Dr. Dukelow. It's from Jennifer Beeman at the Free Press. Is LHSC scaling back its surgical volumes further this week?
Yes, we are. So last week we had gone down to about 70% of our normal surgical capacity or surgical volumes in order to open up beds and free up staff. This week will be between 50 and 60% through the week for the very same reason, as we grow the footprint of our medical type beds. So we have to open up those beds for COVID patients and other transfers in, as well as free up staff to help open ICU beds.
Thank you very much, Dr. Dukelow. And there was a quick follow-up from Matthew Trevithick that actually ended up being the same question. So Matthew, I think we answered that one for you. And a final question, Dr. Mackie, it's a follow-up from Wendy Spence at the Dorchester Signpost. And Wendy's asking if you have a sense of a breakdown of where the cases are in Thames Centre. Do we know if they're in Dorchester or Thorndale or any of the other municipalities?
Yeah, thanks for the question, Wendy. We don't do analysis at the municipal level below the official lower tier municipalities. So Thames Centre is where the residents would be captured in our data set.
Thank you very much to all of you. That does bring us to the end of today's questions and over 5 minutes of overtime, so that's not too bad. Want to thank you all for taking the time this afternoon to join us for the virtual media briefing, and to thank you for being in attendance as well. That's all for today. We will be back with our next virtual media briefing on Thursday afternoon at 2 o'clock. We look forward to seeing you then. So long for now.